Correctly marking the spots for punching the rubber dam is crucial. Generally, there are two methods to determine the punch spots on the rubber dam. The first method involves placing the rubber dam directly over the teeth to be isolated in the mouth, marking the spots directly above them, and using the teeth as a guide. The second technique involves selecting the field of treatment, placing a template over the rubber dam, and then marking the holes accordingly. Each of these techniques has its own advantages and disadvantages. The advantage of the first technique is its directness. When we place the rubber dam directly over the teeth, we can mark the spots according the real condition of the teeth. This method is particularly useful for teeth that are buccally or lingually positioned, or in cases where there are missing teeth, class 5 restorations, or diastemas. We can simply mark the spot accordingly without additional concerns. However, placing the rubber dam directly over the teeth to specify the punch spots also has disadvantages. First, the rubber dam must be placed in the mouth to mark the spots and then removed to punch the holes. This process requires that the punch be autoclaved each time it's used. Consequently, you would need multiple punches, and the tip of the punch will lose its sharpness after multiple autoclaving cycles. If you choose to use this technique and place the rubber dam directly on the teeth to determine the position of the holes, there are several points to consider. First, you must accurately position the rubber dam in the mouth. Then, carefully stretch the rubber dam over the teeth you wish to mark. For instance, if I want to mark the first molar, second premolar, first premolar, and canine, each mark must be placed at the center of the respective tooth. After accurately marking the spots from the center of the teeth, we will punch holes in the rubber dam, as demonstrated in previous videos, based on the size specifications provided. We will then install the rubber dam onto the mouth. The main difference in marking spots on the template is that we can specify the field of treatment, and then the assistant can mark the corresponding teeth on the rubber dam template and punch it accordingly. For instance, in this specific situation, if we need to mark the spots from the first molar to the canine, the assistant can position the template centrally and mark the spots accordingly. In this view, you can observe that using the teeth as a guide for marking the spots results in greater distances between the dots. Typically, the distance between two holes on the template is about 6 mm, but when placing the rubber dam directly on the teeth, this distance increases. Therefore, it's important to stretch the rubber dam properly to ensure it fits correctly over the teeth and aligns with the marked spots. The technique I personally prefer is using templates because they are practical in 90% of cases and don't require any modifications. Moreover, by using a template, we ensure that the punch remains clean, allowing the assistant to use it multiple times without needing to autoclave it. As I've mentioned, using templates is quite straightforward in most cases and can easily become routine. Since the assistant handles part of the job, it simplifies the installation process. However, there are special cases to consider, such as class 5 restorations, diastemas, tilted teeth, and others, which I will elaborate on in upcoming videos. If we want to use a template for the upper jaw, we should simply position the template in the center of the rubber dam and mark the locations for the holes. For instance, if we have a 6-inch by 6-inch rubber dam and the template is appropriate for the same size, we simply place it in the center and mark the teeth we intend to isolate on the upper jaw. If the treatment area is on the lower jaw, and we place the template in the center of the rubber dam to mark the holes, for example, from the first molar to the canine, there will be a significant amount of rubber dam material remaining behind our marks. This excess material could end up covering the patient's nose, which is something we need to avoid. To avoid covering the patient's nose with excess rubber dam material, we can adjust our approach when using a template for marking holes. Draw a hypothetical central line on the rubber dam and align the template so that the last tooth on which we plan to place the clamp is situated at that line. This adjustment ensures that the rubber dam is positioned correctly and minimizes excess material at the back, preventing it from covering the patient's nose.